The last debate before the general election, both the Taoiseach and Taoiseach were asked a key issue heading into the election. Eamon Gilmore said it will be looking after people with disabilities. While the current Taoiseach and the Kenny stated, I agree with that, and I feel an absolute priority should be the 300,000 people who suffer from mental illness every year. Unfortunately, the reality over the last 3 years has been different. There have been cuts to disability services pretty much at all levels across the system. We also have a situation where still many children with special needs have no access to preschool services. I think we're all agreed, we'd have debates previously in this House on the need for early intervention, particularly for children from disadvantaged areas and for children from special needs, so that they get the appropriate intervention as early as possible and don't fall behind and don't end up in a situation by the time they're going to school at 5 or 6, they're already really far behind, and they need much more intensive education. If they haven't had speech and language or other services that they need, then their development is already cut back by that, by not having that intervention earlier. And I think that is an area that really needs to be prioritised. There are many children with special needs who are not getting any preschool service at all, who are finding it impossible to get accepted into a service. And then there are other children, particularly in the community sector, where the community creches are trying to welcome everybody. They're accepting children with special needs, but then they're finding that they don't get the support they need, they don't have the staffing they need to actually be giving them an appropriate education, and that is a difficulty. We need to make sure that the appropriate supports are in place so that children with special needs have the same entitlement as everybody else. We have legal entitlement in the Education Act and the Epson Act for school-aged children. School-aged children have a legal entitlement to a school place and to support, but that mandate is not there for early childhood care and education provision, and I think it's an area that really does need to be prioritised. One of the other big gaps, and I know my colleague Senator O'Brien will speak more on this, is that children with special needs are being denied access to publicly funded health therapies like speech therapy and occupational therapy. Indeed, in my own area in North Dublin, the Minister of State should be familiar with this. The waiting list, even the list, even just to get on a list for a service, was closed in November 2012. So somebody who needs those services can't even get on a waiting list. And I think that's a really shocking indictment of the priorities that the government has had over the last few years, and it's something that really, really needs to be addressed. In other parts of the country, the service is quite good. We debated this recently I put down a motion at the Oireachtas Education Committee before the summer, and heard that in other parts of the country, the services are very good in Cork and elsewhere. But the reality is, in my area, I have parents writing to me, I have parents ringing me in tears who can't even get on a list for a service. And are left in a situation where they're seeing the impact that is having on their child, and they can't do anything about it. I think that's really shocking. At the school level, the cap on special needs assistance and the arbitrary cut in resource teaching means that primary and second level students are not getting the support that they've been assessed as needing. So with the resource teaching, they're assessed as needing a certain number of hours, and then they're told that they can only get 85% of that allocation because a financial cap has been put in place. Again, I think that has been very unfair, and I think the lack of we rightly adopted some years ago a principle of including special needs children in mainstream schools. Where appropriate. Some children will still find, some parents will still make the decision that their children, if their needs are complex, are better off in special schools. But we wanted to have a system where, as a decent society, we said that any child is entitled to go to a mainstream school, and we'll put the supports in place to assist them. But the reality then for the schools is that it's very frustrating for the teachers when those children present and they're not getting the supports that they need. And again, the gap in the health therapies, where children are getting an educational provision. You have schools that, again, the Minister of State will be aware of, some schools in his own constituency in Dublin Bay North that have opened special classes, have been given the educational intervention because you're entitled to a certain ratio of staff on the education side, but cannot get any speech and language for their kids,
Senator.
which it cuts to beach park services and elsewhere, which means that, again, those teachers are pulling their hair out and upset that they have children in their schools they can't really provide a proper service for. And I think all of these things, if they're looking into the budget, and there's much competition between the two government parties over recent weeks arguing about which tax cuts they prefer, I think that the priority in the next budget, if for whatever resources are available, should be providing a decent level of public services, and particularly protecting those who are most vulnerable. It should be protecting people with disabilities, protecting people from disadvantaged areas, and undoing some of the crueler cuts from the last few years. I could go on at length about NEPs and about all the other issues. Just want to mention as well the need, and I agree with some of the comments made by Senator Maloney as well, about appropriate places for adults in training and education. And many of us were at the briefing that was organised last year about adults with intellectual disabilities who, when they finish school, while everyone else is offered a suite of different choices, they're forced into a care session with somebody to just look at them all day while they're sitting around, and yet they're capable of doing so much. They want to be working, they want to be in training.
Thank you, Senator.
And they need to have better options. But
Thank
that's
you.
why we're putting forward a more detailed motion, and I would urge senators to support it. Thank you.